Good morning and welcome to our Good Health Radio program brought to you by Good Shepherd Healthcare System in the KOHU studio. I'm Caitlin Kozad, the host for Good Health. Joining me this morning is board-certified gastroenterologist Dr. Joyce Koh. She's heading up our new service line at Good Shepherd. It's called Good Shepherd Gastroenterology. Dr. Koh, thank you for joining us this morning.
Good morning. Thank you so much for having me, Caitlin.
So we're very excited to welcome you to our medical staff. Tell us about your role at the Gastroenterology Clinic.
Well, my job is to see patients with all kinds of GI concerns, whether that could be stomach pain or colon concerns, liver concerns, and to meet with them, try to decide on a plan of care and possibly evaluation with procedures like upper GI endoscopy and colonoscopy.
Yes, and this is such a much needed service to bring to the community, and you're heading this up. What's that like to lead this program?
It's very exciting. So far, I've been so impressed by the hospital. As everyone around here well knows, this is a fantastic, well-established hospital, always innovating, and the best part are the people there. So not just the doctors and the nurses, but all the support staff. I can't say enough, and I'm just so happy to be here and working with this fantastic crew.
So how did you come to be here at Good Shepherd?
Well, my journey, I guess, started as a child, being interested in medicine when going to my pediatrician and seeing how she would assess me, and just she had this calm confidence, and I could just see her interest in me, but also just her broad base of knowledge. And after college, where I was a history and East Asian studies major, I just kind of felt that pull to be involved in the care of other people and to know people's stories through their healthcare journey. So I went to medical school in Pennsylvania, which is my home state, and then I was in private practice in Maryland, and then after our COVID time, so to speak, ventured out west to be a little bit closer to some of my family, and I've been roaming about, so to speak, but I think I've found a very good landing here in Hermiston, so a fantastic place to be.
Yes, I was going to ask, what really inspired you to choose to be at Good Shepherd?
So reputation for sure. You know, I was told about this hospital, this kind of almost oasis for healthcare, a place where patients could, get pretty much everything from head to toe taken care of close to home and by folks who are at the top of their field. So I said, I got to find out about this and see it for myself in person. So I came and I'm here.
So getting back to your education background, were there any particular challenges you faced during your training, and how did that shape you in your approach to patient care?
I think not so much challenges, but I think actually I was very fortunate. Part of my training, some of it involved home visits for patients who had been in the hospital. So actually I was blessed in a way to see even more of the patient's story and journey, because a lot of what we see in the hospital sometimes it's just not enough. It's just a snapshot. It's that point in time when this person is, maybe at their worst, and to see them in the context of the life that they want to live, the people who care about them. That was very inspiring during my training. And that always helped me to try to remember every morning heading into the clinic or heading into the procedure room, okay, what steps did this person literally take to get here? And it's just mind-blowing sometimes and humbling to think about, where they come from and what hurdles they may have overcome to just be there for their care that day. So I consider that, an honor and a privilege.
Yes, absolutely. And how long have you been practicing?
It has actually been over 10 years now, so I would, without divulging any more, because you want to keep a little mystery, right? No, so I've been very fortunate to, be doing this for quite some time, so hitting my stride, so to speak.
If you're just joining us, this is Dr. Joyce Koh. She's a gastroenterologist that just recently joined the medical staff at Good Shepherd Healthcare System. So tell us about gastroenterology. What's the scope of services you can provide?
Oh, I just love how you invoke the word scope. Thanks for feeding me that one. But yes, scopes, or what we call endoscopy, and you may have heard of colonoscopy, a lot of you out there, which is a very routine, common procedure for folks over the age of 45. So just to give a little background, I am internal medicine trained, also board certified in internal medicine. So that was the base of my training. And then beyond that, the GI and general hepatology field, meaning disorders of the gut. And that can be anywhere from the esophagus, the stomach, the small intestine, the colon, and then also includes the liver as well. And then as part of what I do, diagnosis and treatment can come through performance of procedures, which are upper GI endoscopy mainly. So a camera put into the esophagus, stomach, and the first part of the small intestine, and then our probably better known colonoscopy, which is the inspection of the rectum and the colon. So whether a patient's suffering from intense stomach pains or maybe bowel problems, whether that might be not going frequently enough or going too frequently and beyond, or maybe they've been told that something doesn't look quite right on their liver. Those are all kinds of things. It's really a broad array of disease processes that I get to be involved with.
And so colonoscopies, is there a certain age that we really should start getting our colonoscopies, and how often should we be getting colonoscopies?
Yes, right. Great question. So for many years, age 50 plus, what a nice round number, right, was designated as the time for getting screened for colon cancer for folks who are what we call average risk, meaning that they don't have a family history of colon cancer, or they themselves have not been diagnosed with colon problems like colitis or colon polyps in the past. But unfortunately, and there may be various factors that have gone into this, we had seen an increase in younger age colon cancers. And for the last several years, the guideline has been to start with the average risk patient at age 45 and not to wait till 50 for colon cancer screening. Mm-hmm.
Okay.
Yeah.
Yes, that was going to be my next question. It's just that it seems there's a prevalence of younger folks suffering from this.
Right. Yeah. So I would say, even in my training, oftentimes that would not be on our radar. Unfortunately, we just associated colon cancer as a disease associated with age. Some risk factors, possibly things like maybe excess alcohol or smoking, but we are seeing in folks who are very active, maybe eat a very so-called clean diet, not a lot of processed foods, who are, under the age of 40, there's been a spike, so to speak, of colon cancer in those age groups. And, not to, scare anyone out there, but what that means to us as gastroenterologists, as healthcare providers, is, to let you all know that if you have any changes in your bowels or unusual appearance to your stool, which is new and persistent, not explained, blood, clearly, it's a very good idea to talk with your primary care physician, or if you're able to directly come to the clinic just to discuss. It doesn't always mean that it's going to be bad news, but that's what I would say is, a discussion should be had. You're never too young to raise your hand and say, I'm having a problem, let's talk about it, right? So there's no shame or, should hopefully not fear in that, okay? Because it's still a rare diagnosis, but we just don't want anyone to feel dismissed or that they can't reach out to talk about a concern.
Absolutely. Mm-hmm. And I was going to ask the age range of patients you can care for.
So adults, so I guess 18 plus is the crew that I see.
Okay.
Yes.
And so so you were talking about the signs and the symptoms, what to kind of be on the lookout for, and then if they see those signs or symptoms, they can give the gastroenterology clinic a call, or they can talk to their primary care provider. So
Absolutely.
So let's dive in a little more on those signs or symptoms.
Yeah. So sometimes actually colon cancer is without symptoms, and that's why we say, even though you don't have symptoms, let's do screening, and that's the true nature of screening. But again, for folks out there who are listening, if you have a new abdominal pain, right, that isn't explained. So, you say, oh, it's, been a few weeks or even months and I have a pain. I don't understand what that's from, with no clear cause. That's definitely something to make a note of and see your doctor or call the clinic here to set up a consultation. Changes in the bowels. So, right, everybody is different, right? Not everybody goes once a day at the same time of day, right? You kind of have to know your own baseline. But if you see that things are different for you, right? Like we're asking you to kind of think about, okay, yeah, let me take a step back. Is there any change there? I know not everybody wants to think about their bowel movements, but I'd like to take away that stigma and say, yeah, it's good to know what is your rhythm or what is the appearance of your stool. So you may have to peek in the toilet or, if you see blood or black tarry stools, right? These could be signs of abnormal abnormal growth inside of the digestive system, which is leading to blood loss. And then changes, again, in the bowel habits. Maybe you used to have a bowel movement every day, but now it's every 5 days, right? That would be an example. Or maybe stools that look abnormal. Maybe they're a different shape or, maybe even explosive, right? To be graphic, right? Because I want everyone to be aware and don't be shy, right? I'm used to hearing this kind of thing and I want to know about it. Again, not necessarily because it means that it's cancer, but, it means that something's not quite right and you're probably not feeling so great about it. So I'm here to, listen about it and try to help about it.
And so now talk about treatment options. They come to see you and they've got a problem. What's the range of options available?
Yeah. So, even beyond the colon, right, we often see folks with indigestion. Maybe they've got a touch of an ulcer. Maybe they have a bacterial infection in the stomach, right? So fortunately, right, it doesn't necessarily mean that you're going to need to be referred to one of our wonderful surgeons, but often, right, what I do is medical treatment or modification of diet and lifestyle. So that might be a medication targeting the area of ulcer. It might be eliminating things from the diet. And we try to be very thoughtful and directed at what we do. Or we come up with a plan. We say, you know what? All the signs and symptoms point to this being the problem. Let's give this, modification in your diet a try. With the colon, actually, colonoscopy is a preventive tool for some folks who have colon polyps. Actually, during routine colonoscopy, we can, by and large, remove almost all precancerous growths right away when we detect them at the time of your colonoscopy. So actually, it happens right then and there, and it's really fantastic to take out those growths and actually know we are preventing the development of future cancer.
Amazing.
Yeah.
And we've already announced to the community that you're here, and one of the questions we just received online on our Facebook page was a gentleman that asked, he said, is there any alternative to colonoscopies? Because he cited that they're very invasive in his opinion. What can you say about that?
Sure. Yeah, so I think choice is very important, and an informed, educated patient is, one who's going to be at ease, feel confident about their plan of care. So certainly colon cancer screening is not just isolated to colonoscopy. I would say the other very common, easily accessible test for, again, folks who are average risk would be a stool-based test. So an actual sample of your feces. And that can be done through a small sample, and that's called a fecal occult blood immunoassay, meaning it's checking to see if there's any hidden blood in your stool, which could be a sign of colon cancer, or something called, the proprietary name is Cologuard, which looks also for hidden blood, but also maybe for abnormal DNA in the stool. And those tests are just reported as either you get a negative result or a positive result. Beyond that, it doesn't tell you more. But if the test comes back positive, the next step on those stool tests is to undergo the colonoscopy just to investigate yes or no. Is that positive result because of an actual colon cancer? Or is it a so-called false positive? However, if those come back negative, then we say, yep, you've checked the box for your colon cancer screening for this year or the next few years. And that is absolutely an acceptable examination for folks who may have very particular reasons for wanting to avoid the bowel prep, or maybe they have some concerns about the sedation, which we do offer patients. Side note, very quickly, unsedated colonoscopy is possible. It's typically not the most popular choice, but I do want to put that out there. So, again, like I'm talking about options. So these things are, available for discussion, either with your primary care or with us in the GI clinic.
Wonderful. And another question I thought of, what common misconceptions do patients have about gut health disorders, does it seem?
Well, that's a great question. And so many things out there, right? I'm thinking about TikTok, Instagram. I love to scroll through those things because I learned something, or I see what's the buzz out there, or what are the questions out there. And, I think that to some degree gluten might have gotten a bad rap, or, wheat-containing products. Certainly not to dismiss anyone there are folks who have celiac disease, which is an autoimmune disease in the gut, which is triggered by the ingestion of wheat. And that can be very disabling. And there's also folks who cannot tolerate gluten. They just feel miserable, right? We're talking you eat something with wheat in it, and within a couple hours you say, oh, I've got pain or bloating or the runs or nausea, etc. But, I think maybe some of the confusion is that a lot of things that have gluten, a lot of these goodies that we like with flour and wheat and what have you, sometimes they have other additives, and those might actually be what's driving the issue. So I always want to, if I can, meet with someone to talk about their concerns about gluten first before they completely eliminate it, because that's very life-altering. We always also know that elimination of gluten might be associated with a little bit increased risk of heart disease. And we don't know if that's because, right, you may be eliminating other good substances in the diet, and therefore increasing the risk for heart disease in the future. But again, so it's something where I say, let's discuss before you make a lifelong decision to, throw that gluten out the door, because there might be benefits to it as well. Yeah.
And it makes me think about, lifestyle. So what role do lifestyle changes play in managing gut health?
Oh, my goodness, right. So I could go on and on, and lifestyle changes, that runs the gamut. But we know that regular physical activity, right? Our guts they have their own nerve system or center, so to speak, right? And they're richly innervated, and they can be affected by the good and bad stress hormones that we experience in our day-to-day life. So I always like to tell people, try to incorporate some degree of good stress in your life on a hopefully everyday basis, even if that's 5 minutes of doing something. Maybe you're doing a couple jumping jacks, or you're taking the stairs at work, pushing your body in that way. Guess what? That actually feeds back into your gut in terms of the movement of your gut, helping with digestion, helping with the movement of your colon, and releasing, endorphins and hormones, which are very important for the gut bacteria that are present there in your gut, and helping with a favorable balance. So I say, if you could just do something is better than nothing, and I call them exercise snacks. I think that term has been put out there. That's not my original term, but I love to snack on something, whether maybe, yes, I love potato chips, side note, but, apple or a banana, something like that. But then I say, okay, I've had my little, snack to feed myself, but let me, feed the rest of my body and my mind, maybe with like a little spurt of exercises.
Yes. And then I think about prevention in general. What's some advice you would give to prevent any complications down the road?
Right. Well, speaking of apples, right? That old saying, an apple a day keeps the doctor away. Of course, we love to see you and want to see you, but incorporating that fiber in your diet. So a lot of things, right? Our overall body health starts in our mouths, right? And then onwards with the digestion. So the things we put in our body, things where I say, okay, you can look at the list of ingredients and most of those ingredients, right? And this is not to shame or judge, because believe me, if you see me at the store, my cart will be filled with all kinds of different things. But just trying to say, okay, can I see on my plate there's something colorful, or maybe there's something that's vegetable in nature, or a bean, or maybe I'm limiting my red meat to trying to keep that under 3 times a week. So red meat being, beef or pork. And then also maybe trying to limit, processed meats, maybe like, sausage and bacon and what have you. So that can definitely have a great effect, not just for your, gut, but your heart and your brain. So,
Right.
your primary care, your cardiologist, what have you, et cetera, they all applaud you if, you start to incorporate these little things, and everything's, on a spectrum, right? I'm not expecting people to grow their own food, although that would be so fantastic. But just to kind of maybe explore and be open to putting a little bit something different on their plate if they feel like, it's been a bit drab and about the same old for years, variety is the spice of life, right?
Right. So you had mentioned, folks that are checking out TikTok and social media, there's so much being thrown at them about what gut health should look like and what they should be doing every day in their lives. And so I think of things like, I've seen we should be having apple cider vinegar in our diet every day, or we should be having a probiotic or a prebiotic. Right. Can you talk about those?
Oh my goodness, right? So with the prebiotics, the probiotics, for folks out there who might not be familiar with that, those are bacteria are probiotics, and they're often in like capsule form, or they can be added to foods, or they're naturally occurring in foods like yogurt, which are created with cultures, which are, they're bacteria, right? We're all like ingesting those on purpose oftentimes. And then prebiotics, which are substrates which we think can promote a healthy gut bacteria balance. So certain kinds of fibers, for example, you might know your old Metamucil, your psyllium fiber, that has prebiotic effects. So we understand as a medical community that these are very important for gut health. The difficult part, and the part that we're really trying to dial into and hone further, is, what strains of bacteria or what types of prebiotics are the best or most favorable, and how do we manipulate that, right? Because if I give you a capsule with XYZ strain of bacteria, how do I know that that's going to survive your stomach acid and get into your intestine and populate your intestine? Or maybe there's something about your intestine that it needs to be fed in a different way. Certainly, I appreciate that the buzz is out there, the conversation's being had. I do feel a little hesitant if I see anyone, like maybe an influencer who says, this is the brand that I use. And I mean, that's great. Just keep in mind, that's their story. So typically, these are quite safe for generally healthy folks. So giving it a shot is reasonable, but try not to put all your eggs in that basket. Try to think of it broadly, right? There's not typically one magic pill that's going to do it all for you, right? So if you think of it in that way, say, I can give that a try, observe, but, temper your expectations. Always try to make sure that what you're buying is from a vetted source, that it's not something that maybe could have contaminants, because we know, right, whether it's, food that we ate or a pill that we take, even if it says natural, right? There's always a chance that maybe there's something in there that's not quite the right fit for you, or can maybe hurt you. So just be careful and be aware. And again, right, if it costs a lot, or someone's telling you that, this is the only way, or this is wrong, or you must do this or that, again, proceed with caution. That, again, also goes for the apple cider vinegar. I think for some folks that can have great metabolic benefit, but for our folks who, for example, I do a procedure and I say, wow, you've got a lot of ulcers in your upper digestive tract, and that's from excess acid. In your case, if you can imagine, that apple cider vinegar with that low acid pH is adding fuel to the fire. So again, everybody's a little different. So just take care to listen to your body and, reach out to your doctor.
Great advice. I wanted to ask, do you have a great patient success story you'd like to share with us today?
Yes. So probably one of my favorite stories is, and one of the reasons why I went into, GI, and something that, continues to inspire me, was a case with an elderly woman, very frail, just basically skin and bone. And and it was shocking. She said she could not swallow, right? And you think, wow, how is that possible? What do you mean? Like, you have all this food at home and none of it's going down and it's coming up? Are you forcing it out? Are you vomiting? But that wasn't the case. She literally had what's called achalasia, a movement disorder of the esophagus, whereby the esophagus will not open up and allow food to enter the stomach. And so, as you can imagine, the pain and discomfort and the suffering and the wasting away that comes from that. And then because she was so frail, she was not a candidate for surgery, which can be the definitive treatment for this. But as part of the GI team, we were able to take that now well-known Botox and actually inject it in her lower esophagus, help to open up that area which was just so tightly closed, and she was able to start to eat again. And I had the privilege of seeing her at home after that procedure, and I remember her walking me around her kitchen, showing me things that she was actually partaking in. So obviously that's kind of a dramatic story, but certainly, it's something that just, continues to inspire me and think, what, just keep looking, keep pressing, ask the questions, first of all, about what's going on. You may discover something which explains what's going on. And, if you're, privileged, you can have a role in helping to, treat that with a lot of success. So that's one of the stories that I can think of. Yeah.
It's wonderful. Thank you for sharing. It is time to wrap up Good Health. Is there anything else you'd like to share with our community?
I just want to say that I am, as you can probably hear, really excited to be here. I do consider it a privilege. I really, take it to heart. The steps that you have to take to reach out and maybe start on your healthcare journey. And so, I hope that you will find that we inspire confidence in you and that we can be your partner in improving your health.
Dr. Joyce Koh, board-certified gastroenterologist and hepatologist, just joined Good Shepherd Healthcare System in our Good Shepherd Gastroenterology Clinic. If you have any questions, you can message us on Facebook. We will post a podcast from today's interview soon. And certainly you can call our gastroenterology team anytime, 541-667-3804. Dr. Koh, again, thanks for joining us today.
Thank you very much for having me.
Again, this is Good Health, brought to you by Good Shepherd Healthcare System and the KOHU studio. Thank you for joining us, and be well.